Welcome, everyone. It's noon, and we'll start our webinar for today. My name is Erica Wilson. I'm a psychologist at our Employee Assistance Services, and today's topic is on menopause. It's not just in my imagination. And I chose this topic because for many years it did feel like menopause was in my imagination, and I had a hard time finding support and information and help with the things that I was experiencing, with the changes that I was noticing. So I thought it might be a good idea to do some more research and share with all of you today what I've learned. I hope that there are some gentlemen out there listening too, because us women need your support as well during these times, or you might have noticed that your relationships have been affected in some way. So the objectives for today are to define menopause, review common experiences and symptoms, promote awareness of the psychological impact of menopause. I'm a psychologist. That's what I know the most about, so that's a perspective that I'll be sharing today. Also, I'd like to provide support to women and their families and empower women to take appropriate care of their bodies. So let's start off. I found a bunch of definitions which I was really surprised about, but apparently menopause has different definitions based on how a woman enters menopause and the timing of the changes. So the technical definition for menopause is the end of menstruation, and that's something that's determined after a period of 12 months in a row without any menstrual periods. Perimenopause is that time leading up to menopause when estrogen production slows down. So today, the bulk of what I'll be talking about and sharing is about perimenopause and that kind of long time period of where changes are happening with just about every aspect of your body and experience. Postmenopause is the time after your last period. Sometimes this is referred to menopause as well. There are different kinds of things to consider with postmenopause, so I think that is a real distinction, especially when it comes to our medical, how we interact with our healthcare providers. Premature or early menopause describes when a woman reaches menopause in her 30s, and so that is especially early, but it is something that can happen, and for that particular woman can be completely normal. Induced menopause happens when there is a health or medical or surgical reason that leads to the stop of menstrual periods. Chemotherapy and radiation for the treatment of cancer is a very common one. Others involve removal of both ovaries and also anorexia, when the body weight gets so low that menstruation stops and can stop for a long period of time, long enough for it to be menopause. With respect to these kinds of menopause, sometimes the effects are reversible. It may take a while for it to happen, but your period may return. So before we go into the empowering facts, I do think it's important, but I just want to give you just kind of like a time range when I'm referring to menopause. And so the literature said that between 40 and 55 is a time when most women will reach menopause, and that 51 is the average age when most people reach menopause. And so there's a lot of variability there in terms of what might happen. The empowering part about menopause is that it's not a disease, it's not an affliction or a dysfunction or a personal failure. So just in the same way that starting menstruation wasn't a disease or a dysfunction. And so it's a very natural and necessary part of our development in life. And it's not necessarily going to be a problem. There are a lot of, joking and teasing and humorous things around what happens with menopause, but not every woman's going to go through them, just like not every woman has the same kinds of experiences with pregnancy or with menstruation. The important part to remember at this stage in life is that you're better equipped to deal with this change than some of the previous ones that have come along. So some common physical characteristics are hot flashes and night sweats, and I think those most folks know about because those tend to get the most attention. Any kind of change in menstruation is another clue that menopause may be starting or perimenopause may be starting. Other kinds of physical symptoms are fatigue, dizziness, weight gain, vaginal dryness and loss of libido, and also sleep disturbance. Common mental characteristics around menopause are poor concentration, fuzzy thinking or brain fog, and memory lapses. And a lot of these characteristics are related just to the hormonal changes that are occurring. I will talk about some other things in just a moment that are also going on at this time of life. So not everything can be blamed on menopause, but certainly estrogen is a big player in how our bodies and our brains function. So when it starts to dip, it does have an impact on us typically. So let's go to the next slide. So the other thing that's happening during this stage of life is that we're getting older. And when we see that there are changes in memories, sometimes this is really scary because the first thought is this the start of something? And usually that's referring to some form of dementia process. The bottom line is, as we get older, there's going to be normal wear and tear on just about everything, and our brains included. So we're expected, like it or not, to forget some things. And so there are normal kinds of changes that come along at our developmental stage. So here's a comparison so that you can understand a little bit better about what normal forgetfulness looks like and what dementia looks like. So misplacing or losing something, it can be expected. Getting lost in familiar places or being unable to follow directions, that's a bit more severe of a problem. Having a word on the tip of your tongue and not being able, you know what you want to say, but you just can't quite get it out, can be expected. Frequently forgetting words or misusing them frequently is a different kind of problem. Walking into a room and not remembering why you walked into that room or having an appointment slip your mind is something that you're likely to experience. But being aware that you're even forgetting something or not being able to basically complain about a problem because you don't know it's there is more of a sign of something more serious. So there's lots of things that you might experience that are different, but it doesn't mean that these are any kind of early signs or warning signs of dementia. There are some things that are helpful in terms of our attention and memory to kind of keep them at their optimal level, let's say. And these are not groundbreaking things. They tend to be the same things over and over again when it comes to our health. But exercise, anytime we're moving physically, our blood flow is going throughout our bodies and it's also going to our brain. And that helps us to be more attentive, it helps us to clear things out, and it helps us to actually put things in our memory so that they're stored safely and we can get them out when we need them later. meditation is just another form of practicing how to focus. That's the main point of meditation. You sit down, you focus on one particular thing. When you get distracted, you call yourself back to that particular thing. So meditation in and of itself is a way to practice focusing and concentrating. Puzzles are great. Old school crossword puzzles, word searches, Sudoku, reading books. These are all things that help you to engage your brain, to help you concentrate, provide thinking and problem solving, and these stimulate the kinds of connections that our brain has and allows us to remain as sharp as we possibly can. Sometimes it's not so much about how we're practicing things, but what other things can we use that are laying around just to use as reminders. Making lists or notes have been popular for a very long time, and they still work really well when you need to remember certain details or need a reminder of something. We have digital devices nowadays that make this really super easy, and it's important that we kind of get away from thinking that if we start using reminders that our memories are going to get worse. Not so much. Using reminders won't have an impact on how your brain is functioning. It'll just help you be a bit more accurate in what you're trying to do. Assertive communication is also a way of supporting attention and memory. And what I mean is oftentimes we're saying yes to way too many things. And so there's no way we're going to be able to manage all the things we're saying yes to. And some of those are just kind of drop by the wayside, and oops, I forgot it. Well, you never were going to remember it because it was too much of a load to carry in the beginning. Lastly, there are brain games. Luminosity is a really popular app that has brain games, but most of our phones have some sort of brain games that we can access and play quite a bit. So let's look now at some common emotional characteristics. And these are things that if we're not noticing in ourselves, certainly the people around us are noticing and commenting on. Mood swings is a big one, kind of that hot or cold or that quick shift from one mood state to another. Irritability, having low patience or tolerance for things or having quick reactions to others, depression, anxiety, and panic. So let's talk a little bit more about depression because there's actually quite a bit of research on depression. There's the popular SWAN study, and SWAN stands for the Study of Women's Health Across the Nation, and it's a huge study, and it spanned about 10 years. And so they were able to assess for depression and a lot of other things in women at different stages of menopause. And they defined depression in a couple of ways, but one was brief sadness or feeling blue, as well as irritability, and the other one was negative mood for at least 2 weeks that caused a lot of distress or impaired daily functioning. And so basically the negative mood was creating a lot of problems in just getting along in the day. And the results were that the risk of depression was greater during perimenopause and possibly also postmenopause. And so there's now actual research to document those things. The specific reasons for the greater risk were not well understood, and I'll talk about that a little bit more on the next slide. But multiple factors do seem to contribute to the depression at this stage of development. And those, I think those might be on the next slide. Why don't we check that out? Okay. So let's look at the risk factors that came from the SWAN study. So By risk factors, I mean these were the things that were associated with the women who were reporting more depression during perimenopause. Having a history of clinical depression, so something that has created problems in the past, was a risk factor. Not having appropriate social support, so people around you to provide emotional support. Discomfort from hot flashes and night sweats was also a risk factor, and if you've suffered with those, that's no surprise. Other kinds of things going on in life, other psychosocial stressors, things related to changes in family, maybe changes in health. There's a lot of things happening during this time, during this midlife transition for women. There was possibly a correlation or an association with the change in hormones, which is really interesting because you would think during this time that would be like the #1 reason to contribute to depression, like changes in estrogen and progesterone, but there wasn't a very strong link here in this study. Other factors also included educational level, negative attitudes about aging, greater financial strain, and also women entering perimenopause earlier in life rather than later. The SWAN study also looked at anxiety and defined it as edginess and nervousness, panic attacks, and heart palpitations. And heart palpitations are like flutters, that it feels like your heart's skipping a beat. And they also found that there was a link between anxiety and perimenopause. Women with low anxiety were more at risk for high anxiety during perimenopause and postmenopause. And what that means is that earlier in the study, before women entered perimenopause, they were asked about anxiety. And those women who scored low on anxiety actually had higher anxiety once they reached perimenopause and once they completed menopause. The interesting thing is that for women with high anxiety, kind of at the beginning of this journey, were not at greater risk once they entered perimenopause. So the takeaway from that is if you're experiencing high anxiety earlier in life, you're likely to continue to experience it during this time as well. It doesn't necessarily get worse. So other kinds of problems that haven't been studied so much but do exist are problems in our relationships, marital relationships, relationships with significant others. And sometimes that's just related to changes in sex drive and also the comfort around intercourse with vaginal dryness. Other social relationships, friendships, family, work relationships can also be impacted, especially when you're feeling more irritable or having less patience for things, and maybe you used to be able to tolerate them a little bit better, responding in a more aggressive or hostile way to things that are frustrating or irritating, saying something before you realize you said it when ordinarily you wouldn't. That kind of speaks to the poor impulse control. Also putting things off, procrastinating, just because it's too hard to figure out how to do them all. When you're having trouble concentrating or when you're kind of in that brain fog, it's really hard to kind of jump into that rhythm of life that you might be used to and handle all these things that you're used to doing. And finally, just feeling overwhelmed might be related to those changes that happen during perimenopause. The bottom line is Some changes are likely to occur during menopause. The symptoms, and I put them in quotations because I don't want to pathologize the experience, but the symptoms are likely to come and go over time. So, you know, once you kind of think you've figured it out, it might change up on you or just might go away altogether. So, again, perimenopause can be anywhere from 2 to 10 years long. So that's a long period of time to have changes going on, so they're likely to come and go. Each woman's going to have her own experience. I'm sure that we share things, but how it plays out in our lives will be unique. Some women won't notice much of anything at all, which I think is amazing, and that's, you know, my props to those women who don't really have to think about this much. No matter what the changes are, you should consult a professional if the changes cause significant distress or they really start to interfere with what you're doing every day. Let's talk more about some options, decisions, and choices, because there isn't just one way to manage the changes and feel better. So tracking changes that you notice, jotting them down in a journal, keeping a digital notepad or memo of things that you notice with your mood, with your menstrual periods, kind of reminds me of adolescence again, but sometimes you're needing to know, you know, and needing to follow up once your periods change. Lifestyle changes, those are things that can always be done up front. You don't really have to start by seeking professional advice when it comes to lifestyle changes. We know already that lifestyle changes can support a lot of things related to our health and healthy functioning, things related to weight and alcohol and drug use, cigarette smoking, caffeine use, our food, water, and I also put overscheduling here because I do think that we load ourselves up with too much but expect to handle it without being totally stressed out, and that's just not realistic. Talking to your doctor, anyone that you have a connection with, your primary care doctor, your OB, gynecologist, your endocrinologist, your naturopathic doctor, your chiropractor, whoever you have a connection with, you can start having that conversation because it's about your overall health at the end of the day. And educate yourself. We can no longer be passive and expect our healthcare professionals to have everything waiting for us. I haven't found that to be the case. I've gotten some information, but I actually have had to do a lot of things on my own as well. Psychological counseling or therapy can offer a lot of things. Of course, I'm biased. I'm a psychologist, so I think that it can be very helpful in a lot of different situations. Cognitive behavioral therapies are very effective for anxiety and depression, mostly because they challenge negative attitudes and thoughts that keep anxiety and depression going, and also set up action plans, steps that you're needing to take in order to feel better and get your health in order. Couples counseling might be helpful, especially if relationships are suffering because of changes that you're experiencing. Counseling can also help with self-care, kind of creating your own manual of what you need at this point in life to function at your best. Other things that you can learn in counseling and therapy are stress management, coping skills, receive additional emotional support. Maybe you don't want to share what's happening with people that you know, but still need to share it and receive information. Education, and I put it here as grief counseling. That might be interesting, but There are a lot of things that are changing in midlife, and sometimes our identities are changing as well, and we're needing to say goodbye to things that we've known or ways of being that we're used to. Other options when it comes to addressing symptoms and addressing, things that change during this time are medicines, typically in this category of SSRIs, which is an antidepressant medicine, and it helps to regulate a natural chemical that's in our bodies called serotonin, which is related to a bunch of important stuff that you see there in terms of our mood and how we sleep. And apparently I needed some sleep this day because I have sleep in it twice, just to underscore how important that is, and also regulating appetite. Paxil and Prozac are very, very common ones that have been around a long time, that are usually the go-to to start with trying to regulate some of the symptoms. And these medicines will always be prescribed by a medical doctor, so you won't find them in a therapist's office. Hormone replacement therapy is another option, which is there to help relieve menopause symptoms. Estrogen and or progesterone are the hormones that are involved in HRT, and they have different forms, pills, creams, patches, and there's also bioidentical hormones. Dr. Northrup, this will be on a resource slide in a little bit, has a really good definition of bioidentical hormones. I know there's a lot of questions about that, but I'm not an expert there, so I'd rather have her as an expert describe those for you. Over-the-counter supplements are also options for symptom relief, things like hot flashes and irritability. They typically have herbs and extracts in them, like soy and black cohosh. There can be interactions with other medicines, so it's always a good idea, especially when you're taking other medicines, to have a conversation with your doctor about them, or even a pharmacist if you're not able to make an appointment. Here is a Consumer Health Digest. If you just go to Consumer Health Digest and type in menopause supplements, you can get a really good review of the supplements that are out on the market right now. And as a reminder, it's important to work closely with a clinician to decide what's right for you. And if your symptoms are bothersome, discuss your options with a physician or other specialist in menopausal health. Building a strong foundation for health is always going to be involved in helping you to feel better, and those start with changes in nutrition, in exercise, meditation. Again, you'll see that a lot, reducing alcohol, cutting out cigarette smoking, increasing recreation, and also social support. Our services here at EAS are available to help get things started, especially with education, counseling and therapy, making referrals when needed. We have our own wellness program here at the county, the Culture of Health, where additional information on nutrition and exercise is available. Health insurance will cover medicines and counseling and therapy and doctor's appointments to consult and get information about what might be helpful. And there are functional medicine or naturopathic doctors who are more holistic and integrative in their approach. Some medical insurances will cover and some won't. But overall, if you're able to work with someone who is taking your entire health into account, then that's likely to be a good match for you. I have listed some helpful websites, and some of you will have to get these when our webinar is posted to our website. but helpguide.org is always helpful for just about everything. You can type all kinds of things in there and get really good information on those things and also things that you can do. 34 menopause symptoms is interesting. It has a lot of things there that have been reported to be related to menopause. And Consumer Health Digest is also listed here, and 2 other websites that have a lot of good information and things to review. There are some mobile apps also that help with tracking. And so these first 3 help with tracking changes in mood as well as menstrual periods. And the 4th one is a mobile app that really helps with stress management and coping skills. And last, these are 2 books that are extremely helpful. Menopause for Dummies is exactly what it sounds like. It's very straightforward and a really good reference book to have. Dr. Christiane Northrup, The Wisdom of Menopause, is a really good reference as well. She also has a website that has videos, newsletters, and a lot of information about women's health and specifically menopause. So that concludes our presentation for today. This is our contact information. We can be contacted through our mobile app, through our website, and also our office email, as well as the office telephone. And these webinars typically go up about 2 weeks after they're completed to our website, and that's where you can play them again, or you can go to resource pages and get the information that you need to follow up. I appreciate you joining me today. I hope I've been able to empower and also educate a little bit on this time of life. Thank you.